Hello everyone, welcome. My name's Jodie Hartson. I'm Executive Manager of Client Engagement and Wellbeing at MS Plus. Today we're talking about a very important topic and one that's very dear to my heart, and that is about what an MS nurse can do for you. And there are many, many things that an MS nurse can do for you. I'm absolutely overwhelmingly delighted to be joined by three of the fabulous nurses who work here at MS Plus. We have Jane, Bridie and Michael. Jane and Bridie are based in Blackburn here in Victoria, and Michael is our Hobartian. So welcome Jane, Michael and Bridie. Jane and Michael and Bridie have all been MS nurses for many years now and have a wealth of experience. They listen to people's stories all day, every day. They provide services over the phone and some face-to-face visits, but mostly over the phone telehealth services, and have been doing this for many years. In this various type of roles. Bridie's had various type of roles in nursing and has sort of landed back at MS nursing, and Michael the same too, I think, but he's been an MS nurse. Tomorrow, Michael's been an MS nurse with MS Plus for 14 years. So that is an incredible amount of stories. It's an incredible amount of people, of stories told, people heard. Incredible changes in what's happened to MS, but it doesn't take away from that rich collection of, of all the different experiences and all the different things. I think there's probably not much that Michael hasn't heard in those last 14 years. And so I'm going to start a little bit by talking a little bit about what actually does an MS nurses do. And I say that because a recent report produced by MS Australia, who's our advocacy body in the MS family, and we work closely with them, and they did a big research study looking at MS nurses, the value of MS nurses, what MS nurses do, how many people accessed MS nurses, and they found that there was a lack of awareness about what MS nurses actually do, and that 31.5% of people, to be precise, didn't access an MS nurse. And so they have set forward on a campaign to be able to support the value and contribution of what MS nurses do. And part of that is raising awareness. So we thought we'd come together today and say, hey, this is what we do. And we've got some questions at the end that some people had answered, and if we get time to do that. An acknowledgement of country, I would like to begin this meeting by acknowledging the traditional owners of the land on which we are recording the video today, the Wurundjeri people of the Kulin Nation, and I pay my respects to the elders past, present and future. Okay, let's hit it off then, and let's have a little chat about what nurses do. Jane, tell me overall, what does an MS nurse do?
Thanks, Jodie. So MS nurses really provide information, support, advice, guidance, and really help people understand what MS is, how it's impacting them, and also provide really important insight into how to live well with MS.
Right, thanks. So, Michael, tell me a little bit about what your day would look like. What's a day in the life of Michael, the MS nurse, when you're being an MS nurse?
When I'm being an MS nurse, it could look like anything. You never know what calls are going to come through, what advice or support people are looking for. So yeah, it's a bit of a mixed bag. Answer the phone call. Sometimes the calls get transferred directly, so you don't have much of a chance to prepare. So you're sort of going in blind a lot of the time. But and other times people book appointments. So when they're calling MS Plus to speak to one of the three of us, it can be at an arranged time that best suits them. So it's important to, as I said, to understand that you might not necessarily get to speak to the nurse then and there on the spot when you're calling in to MS Plus, but we do our best to accommodate when would be the best time for the nurse to call you back. So yeah, anything can happen. I can pick up the phone, I'll be talking to somebody who might be experiencing relapse-like activity and they're a bit concerned about exactly what's going on, help them to unpack it and sort of say, well, you know, have you got any infections or anything at the moment? Make that determination. Is it a pseudo relapse or is it a genuine relapse activity? Are they having issues with their medication, side effects, management and things like that? Or sometimes people just ring because they want to talk to you because even though I don't live with MS, I certainly understand what it's like for people who do live with MS. So maybe there might be the occasion where you can't actually provide them with an answer to what's going on, but at least they feel better after they've had a chat with you, to somebody who understands and just helps them to make a little bit more sense about what's going on for them. So it could be anything, Jody. Pick up that phone and away you go.
Well, yes, the nurse's role is extensive. I think they do cover, MS nurses cover a lot, right from, you know, that early information needs in diagnosis, and then right through to managing advanced care planning, end of life planning, and everything in between, really. Symptom management, supporting people through symptom management, supporting people with, one of the things, Bridie, that MS nurses spend a lot of time doing is helping people navigate the increasingly complex healthcare system. How much time do you spend doing that, and how important is that in your role?
Yeah, thanks, Jody. It is actually really important because, and particularly, you know, during the period that we've had with COVID, it made things a lot more complicated for people to try and access services as well. So we actually spend a lot of time with people who may ring in and say, I've got to see a neurologist, don't know how to even start doing that. Where do I go? So, you know, so while we can't sort of, you know, specify who to see, we can at least start that process of getting people navigated around where to actually begin that process, how to get the GPs involved. It's really, I guess a lot of the time we've got people who ring in who have all sorts of different levels of understanding. And so, you know, some people are really quick to sort of pick up how to make a phone call, how to get into services and where to go, where others really need a lot more support around doing that. And I guess that's one of the skills of an MS nurse, is actually ascertaining where that person is at and at what level do we need to interact with them to help get that over the line. And the thing is, with a lot of these calls and they come in, we don't know what that's going to be. There's no script or anything like that. It is just an impromptu, this is how it is, let's ask a few questions, let's see what you've done, where you've been, who you've seen, and then we sort of go from there. And normally we can do that over one call, but it may be that we may follow up in a week or so just to see how they're tracking. Then, you know, and then occasionally we do actually find that people are needing a lot more advocacy and a lot more support to get into, and we may be able to help facilitate a phone call here or there, or you know, talk to services or email some contacts that we have that may be able to, you know, sort of assist people in where they're going. So it is really, really varied. And I guess the other element for us is that we're not just covering one state, we're covering New South Wales, Victoria, ACT and Tasmania. So that can get really tricky and really complicated because each state sort of can work a little bit differently as well. And and their clinics, the MS clinics, they're all over the place, and you know, some have nurses, some don't have nurses. So it's really just getting a gist of all of that stuff and working through that person's call to work out where to go next.
Yeah, I have
Well
heard
said,
you say.
Bridie.
Well said, Bridie. I guess that that it is certainly true that there's broad knowledge that you can read on the internet. But there's that part when you have to relate it to you. And that's where everybody is unique. Everybody's different. Every person from Timbuktu to the middle of Sydney is going to have really different needs and really different stories to tell, and really different sort of, everyone has their own situation. Everyone has their own health story behind them, so which informs how you progress with what you're doing with MS. But everyone has different informal supports. Everyone has a unique need. And I think what nurses do really well is take that broad information and help you fit it with you. and help the person fit it with the person, what they need. Because otherwise it's just information that you've read on the internet. It's not about you and where you need to go. And then add encouragement and support as well to doing that as well too. And I've often heard Jane say to me, you don't know what you don't know. So Jane, tell me how you sort of help a person in that way as well too.
Yeah, I think that's a really good point, Jodie, because for a lot of people, they wouldn't know anything about MS before they get diagnosed, unless perhaps you have it in your family or you know somebody that has it or you work in the space. I know for me, before I worked in the MS space, I didn't know nearly as much as I do now. So I think when speaking to people to figure out where those gaps are, it's understanding what people's questions are, their fears, their concerns, what people are interested in. Because for some people, they'll be very interested in the medical side of things and the medicine and the doctors. Other people are very interested in lifestyle. Some people might not even be thinking about MS at all. They might be thinking, how am I going to be able to afford my future? I've got children, I've got a house, I've got commitment. So finding where people's head is at and what's important to them can then determine, okay, so these are the questions, these are your concerns. This is what's keeping you up at night. What could we do that would help that? And then that's where we use our vast knowledge and pull out little ideas to try and help people learn what they don't know and ultimately help them know that there are solutions to what they're needing to know. And I often think of myself as a broker. I don't have anything for sale myself. I'm just linking you with what other people have already done.
Yeah.
What a great way to think of that we are sort of helping people broker and in that way empowering people as well too, because I think what's one of the unique things about what you all do is really say there's and you have an extraordinary resource of who's who and where's where and how's how, but also how to get to that how's how. We talk about big things like accessing MS clinics, but sometimes it's just as simple as getting a free MRI, and how do you navigate your own local environment to be able to do that? Because there are ways. And nurses, I think, have a special skill of being able to help people find solutions that will serve their own particular needs, which, as I focused on before, they're all very unique. And it's not something that you can necessarily put on the internet, how to find an MRI when you live in Warburton, or how do you find? I couldn't think of a good rural place then. how do you find Warburton's not that rural, but how do you find where to have a blood test? If you don't have the right access or you don't have the right resources. So I think it's that's what nurses are being able to provide with people every day. And certainly one of the other big areas, I guess, is helping people navigate the different MS medications both for symptoms and very importantly medications for disease modifying therapies with MS. One thing we all learnt in COVID was that needs change with people on these treatments all the time. So there's always something new that's going to happen. It's not just that you get on a treatment and you're set for life and away you go. There's going to be responsive needs. So Jane, how much time do you spend talking about that? And how do you support people with that?
In terms of medication, I would say I spend a lot of my time speaking to people about the MS disease modifying therapies because they're the most commonly recommended treatment for MS. So lots of people are being told to consider them or are on them or are changing their drugs. And it's quite a foreign thing, and the idea of immunosuppression and side effects, that there can be lots for people to fit into their life. So I do spend a great deal of my time doing that. And it does change, as you said, Jodie, about what information people are after, whether it's what's the right drug for me and how do I choose. I think at the moment we have about 13 or 14 disease modifying therapies on the PBS, and some just left as well, which brings its own challenges. And then once you're on a medication and understanding how it's dosed, the time, the regime, the method of administration, and then side effects, how it works in your body, if that has any lifestyle implications. So there's a lot to understanding all those things. And we know that that is something you can find online. It is in booklets and things like that, but it's really hard to turn that brochure into lived experience. So it is really helpful calling and speaking to us, for example, to say, what's it like when people are on this drug? Are they still going to work? Are people at home sick? Am I taking weeks off work? What does that actually look like for me? And I think that is something you can't really find that easily without a lot of that extra information that can come that you find on forums and things like that may not be helpful. MS nurses are quite good at sharing experience from years and years
of knowledge. Absolutely, for sure. Now, I've heard that there are different types of nurses, MS nurses, Michael. So can you tell me a little bit about the different types of MS nurses in Australia?
Yes, exactly right, Jody. There's many and varied ways, types that you can get into MS through nursing. Ourselves here today, we work for MS Plus, so we belong to that organisation. A lot of hospitals where people see their neurologist, if they're public hospitals, there's more than likely going to be an MS nurse attached to that hospital, or a neurological nurse. It might not be specifically for MS, but there will be a nurse somewhere. Some of the private clinics will have a nurse attached to them. If they've got a lot of patients, then the neurologists definitely understand the value of having a nurse attached to their practice. Saves them a lot of work, and it also helps with a lot of questions and things that can be directed to the nurse, social questions and things like that, which the neurologists simply don't have time for in their busy schedules. And more often than not, the nurses know a lot more about the way the treatments affect individuals and what the neurologists do. The neurologists understand the end game. This is why we're putting this person on that treatment, but it's the nurses that are probably more tuned into relapse, not relapse, side effect management and things like that. So there's also nurses that would do research when new medications are put onto the out there in the ether to say, well, we're going to test these medications to see whether they're going to be something suitable for people living with MS in the future. So research nurses get on board, not necessarily all to do with medications either. There are other nurses that work for MS Australia, has nurses working there that are doing research in the background to determine benefits of certain ways of managing while you're living with MS. There's continence nurses out there as well, attached to, some of them are attached. We've got, actually we said there's only 4 nurses here today, but MS Plus does have a couple of continence nurses that work for the organisation as well. And in the general community, there's a lot of continence nurses as well. Some of them would understand the management of MS bladder and bowel issues. There's community nurses as well. There's nurse practitioners, a few of those hanging around in Australia as well. And I was trying to think, hopefully I've covered them all.
Well, there's kind
Pretty
of,
much
there's the
sure, I reckon I have. Infusion nurses as well. Infusion nurses at the clinics where people go for their treatment as well. They're not specifically MS nurses, but they're certainly, I think they hear a lot of stories as well while they're treating the patients that come in. So they're not specifically MS nurses, but they certainly would understand. And if you have questions to ask, they can direct those questions through to the neurology team in that hospital as well. So they're also somebody that you can access and use and abuse as well if you want to. Yeah, I think I've pretty well covered most of them, I hope. There's quite a few ways and certainly lots out there. I don't know what our numbers are. Do you remember, Jody, how many MS nurses there are in Australia?
I think last count, there was about 70. Wait a minute.
70
I can
to
look
80,
that up for you.
something like that.
I can look that up for you, Michael, in the nurses report. While Bridie tells us, Jane tells us a little bit about how would you go about accessing? There's lots of different types of nurses, which is great. How would you go about accessing those nurses?
Yeah,
Bridie?
Bridie, go Bridie.
Oh, I meant Jane. I mean that, sorry.
Okay, we won't.
Sorry, Jane.
I'm off the hook. I'm not involved in this one.
Sorry, Jane.
Go, Jane.
Okay, so accessing an MS nurse. So there's a few ways to go about it. You can absolutely call us. So to access the MS nurse advisors at MS Plus, all you need to do is contact Plus Connect by phone or email or live chat. or through the inquiry form on the website and say something along the lines of, "I'd like to speak with a nurse," and they can book in an appointment with you, or we can liaise via email if you're someone that finds it tricky to communicate over the phone, or perhaps when we're working is also when you're working or busy, because that can happen too. So outside of us, most commonly you'll find MS nurses at the public MS clinics. They are most commonly at the tertiary hospitals, so the really, really big hospitals. Mostly they're in capital cities. There are a few regional MS clinics as well, and that's where they have a team of neurologists usually and 1 or 2 MS nurses. So if you're a patient of one of those clinics, you'll be able to access that nurse. And there are a few private MS clinics that have nurses, but it's not overly common. So most of the time, if you have an MS nurse, it'll be at one of those public clinics. But if you're watching us, then you're part of us and you can access us as well. And if you're watching this and you're not a registered client, you're very welcome to call and access the nursing service. It doesn't cost anything, and we usually have quite a quick turnaround for when we're able to speak with you, and there's no dumb questions and there's nothing to be embarrassed about. I tell clients when I'm speaking with them that they should feel comfortable calling back and they're never bothering us. And I say, the only time you're going to get in trouble is if I find out you needed help and you didn't call. That's the only time we're going to be mad, is if you say, "Oh, I've been struggling with this for months, but I didn't want to bother you." You don't need to feel that way. You're very welcome to call us.
And I think a good point too, Jane, is that some of the clinic nurses may only work 1 day a week or 2 days a week, 1 day at the clinic, and perhaps they're off doing something else. So, you know, if the clinic's on a Monday and something happens on a Tuesday, then people will be thinking, "Oh my gosh, I can't wait till next Monday to speak with Jane at the Austin clinic," if that's where you're attending. So that's where we feel a nice little gap as well, that we're still able to jump on and help you out with your questions. As I said, we're not your not your dedicated MS nurse, but that still doesn't mean to say that we wouldn't be able to offer you up some advice and support and point you in the right direction if we can.
Yeah, I think that's really important, Michael. We don't work in silos, which is great. The MS nurses community in Australia is very close knit and does work together to make sure that we can, where it's appropriate. Sometimes questions are not, a quick, like you've said, Bridie, questions can be answered quickly and resolved, straight away, so we don't need to have lots of follow-up visits, but we can certainly defer and communicate back to the nurses in the clinics as necessary.
Sure. Yeah.
And the other thing that you mentioned, Jane, which I think is one of the really important things about MS nursing, is a safe space. And that's often there's no jargon, there's no need to use jargon. Nurses don't use jargon. They don't talk. They're very open and often ask more difficult questions, or questions that can be more uncomfortable. But it's very safe to speak to nurses. And I, in terms of you've got that opportunity to say, "Hey, I haven't really talked about this with anybody else, but I really want to talk about it." And that's one of the really nice things about telehealth too, actually. Is that it can be, you're on the phone, so that creates a little bit of extra safety as well too, so that people can really feel comfortable offloading where they need to, or asking those questions which they just felt they didn't have anywhere else to go. And like you said, there's no right or wrong questions. Every question is okay to ask. And I know from listening to your conversations that if you don't know, you'll certainly find out.
Yeah.
And find out where to go and read, or direct people to say, "I don't know the answer to that question, but I know who will." And that's such an important. I've often said that managing a chronic health condition is as much as what you know as who you know, and having those experienced MS nurses to be able to help you direct to and navigate where to find the information that you need to find is so incredibly valuable as to what you do. So what about when you are, we've talked a lot about access, and we're available Monday to Friday, but there are times when you can't access an MS nurse. Jane, do you have any tips for anyone when they're having trouble accessing their MS nurses?
Absolutely. So if it is a time where we're not working or your MS nurse is not available and you're kind of on your own, it is a time where you're going to have to think about a few things. So the first thing is the need for the nurse. So I would say what you're after, is it advice or information that's quite timely? So is it something that you're thinking is quite urgent, and in which case you're going to need to get advice on that faster? Or is it something that can wait? Quite often things feel quite timely, but they are safe to wait, or you are safe to wait. You're not distressed or medically in danger. But for those times, if you are, there absolutely are general nursing online services, sorry, I should say phone-based services. So like the Nurse on Call, for example, or even the after hours GP hotline, for example, where you can call and speak with a registered nurse. And if the nurse deems it necessary that you speak with the doctor, they'll have a GP call you back, I think, within an hour. And I believe they give a follow-up to your GP the next day. So not MS specific, but someone there to listen to you say, right, this is what's happened, this is what's happening now, this is what I'm worried about, I need advice about what to do next. That can be really helpful. And when it comes to those big picture things, Jodie, I'm sure you would agree that any kind of medical professional, when you're talking about the things that you're really worried about in that moment, can help give you a little bit of guidance. Would you agree, Jodie?
For sure. And I think that there's so much value. A lot of people know the answers themselves, but it's talking it through and getting it to the right place. And you all of you are nodding very much. Often nurses are just helping people get to the answers that they knew what the answers were anyway. But it's just that talking it through. And what a powerful thing to be able to do, and to support people to be able to do. It's such a meaningful thing for people to talk through. And I think that's one of the things that nurses do exceptionally well as well. And it's a really good opportunity. If you've got something sitting, don't let it sit. Because if you talk it through, you'll find the answer. And often it's the answer that you kind of, did or didn't want. When you're talking it through with someone and you're like, actually, I just convinced myself either way. And I guess that's the listening and having those right probing questions to say, oh, actually, yeah, no, I was going to do this. And yeah, now I know that I don't really want to go down path A. I actually really want to go down path B. But I feel better having talked through it rather than sitting with it. And that's such a part of anxiety, I think, is just having it sit there all the time. And if you have it sit there, it's so easy to have what we call catastrophic thinking, which is worst case scenario. And talking it through can really sort of cut it off at the pass in terms of that worst case scenario thinking, which is a very important role of the MS nurse. And perhaps one that you don't really truly get. You don't see the real highlights of that, to say, well, I don't have anything particular now, but actually when you ring them or have a chat, or it seems like a vague concept, but once you talk it out, you think that was really what was at the bottom of my problems, and that was really what was bothering me. And just talking it through really helped as well too. Do you find, Michael, that you spend a lot of your day doing that sort of stuff? Do you find that that's a common scenario for you?
Yeah, absolutely, Jodie. And sometimes there's not an answer, but I think it's just, like you said, we can proffer up and say, well, I can find out, or I'll do my best to find out that information for you. But sometimes, as you say, when you unpack it, you find that there's not really an issue. The person just needed somebody, not necessarily to vent to, but just want someone to talk to that gets it. They don't want to talk to their partners. They don't want to talk to their parents or their children. They just want somebody off-site who's not really that connected to them, who can just listen and guide, or as I said, sometimes all we have to do is listen. Let them know that they're being heard and that we understand what it is that they're going through. We might not always be able to offer up a solution, but sometimes, as I said, there's no need for a solution. It's just allowing that person to speak, to be heard, and to feel better at the end of the conversation. And I often hear that said, thank goodness I had a chance. I wasn't going to call you, but I'm glad I did, because now we've had a good old chat. I feel so much better, and I don't even know what it was that I was worried about. It's gone. And I think that's really nice to know that, as I said, you don't always have to have the solution, but if you're there and available to listen and allow the people to be heard, then that makes a big difference.
Yeah, it's a well trodden adage to say a problem shared is a problem halved, but
Yeah,
it's so true.
absolutely.
Mm,
Yep.
mm,
It's also that real reassurance that what they're thinking is where they should be. So,
Yeah.
that it's so important that just having that discussion and as you said, with someone who has a bit of an understanding of what's actually going on. But I just find that reassurance, and and it's really heartening when people say to you, I actually felt heard, which I think is a fabulous, and it's sort of what we're here for.
Yeah. I don't think
Absolutely.
people always get that from the neuro, do they?
Well, we have time. We
Yeah,
have
that's
time.
it.
And
I think
that's
we're
that's the
very blessed to be able to do is when we book our nursing appointments, we put an hour aside. And sometimes we speak for an hour and 7 minutes and think, I gotta go. And other times it's only 5 minutes and that's fine. But
that's
we have
enough.
the time to work through it, and that often is enough. Jody, I nearly see it as a physical thing when you're talking about getting stuff out. It's getting time to get all your top layer stuff out so you can actually get the deep rooted things out.
Yeah.
And it is really important to take the time to hear what's happening. I sit next to Bridie at work, and many times I've heard her and she's heard me. We've either talked people into the fact that they might need to go to the emergency department. It actually does sound quite serious. And then the opposite of, yeah, I can hear that you're worried. Let's talk about what. Are you actually safe? Are you distressed? Are you all right for the moment? What are we worried about? Because a lot of people can triage physical health problems. I speak to people and say, you would know what to do if you got a paper cut, or if you cut yourself so bad that you could see some of the stuff jiggling around, you would know, oh, got to go to the doctor that's open late to get stitches, versus, oh, I have to go to the hospital, there's a bone hanging out, to I might have to call an ambulance because my whole arm is just fallen off. So people know with physical health, but with MS, Jody, it's a whole other thing, isn't it? You need to learn and get used to it.
And the best way to do that is that he's talking through it can be, so many times I thought people have got the answers in their own head, and we just have to help them get to that, get to that point as well too, to be able to talk that through. We also haven't mentioned, but we also do provide nursing not just for the person living with MS, but also for family and friends. And I know that the nurses here at MS Plus do talk independently, not about the person. Whenever, for privacy purposes, nurses are not allowed to talk about a person, but certainly I've spent a lot of time giving that education and information about what is MS, what are the treatments, what do they mean, to just basic information to family and friends or carers of people with MS. Tell me a bit about that. Bridie, go.
Yeah.
You had your mouth open, ready to go, Bridie.
Actually, I'm quite passionate about this. I find, and with a lot of chronic disease and things that are going on, a lot of family, friends, carers, people that are living with people with the actual disease, sometimes it's very difficult to approach the person themselves. They want to ask a question, but they're really worried about, if I ask that, am I going to upset them? Maybe they'll think this, or or there could be any sort of dynamics. So I think it's really great, and I love it when people ring in anonymously or whatever they, or my husband, my wife, my whatever it is, has been diagnosed, and I've noticed that there's some changes in behaviour, or they're having trouble with continence and they don't want to speak, or just asking those questions to sort of gauge it. That's what we're there for as well. We, as Jody said, for privacy, unless we've got consent to directly talk about someone, we tend to talk about the disease, and what does that symptom mean, and how can that present to that person. So somebody might be really, really angry and agitated, and this person's rung in to say, I just don't know what to do. So we can perhaps talk to them about, oh, look, is that person sleeping well? Do you think that they may have a bit of pain? Let's sort of nut it out a little bit through questions to try and work out what's actually could be going on for that person, and this is how it's presenting to you, and then what can you do about that? And I guess the other side of this then is, okay, where do we direct these people to get help as well? So, oh, look, you know, I'm finding it really, really difficult to cope. I need someone to talk to. Who do I go to? So I guess a part of our role is to also work out what's going on within that unit, or within that, you know, amongst the friends or whatever it might be. Where can we direct those people to? So I guess our knowledge isn't just about, you know, the disease and the symptoms. It also ranges into, where are the support services for the people that are outside the disease, caring for these people, whether it be residential facilities, whether it be, you know, friends. Sometimes we even get, you know, friends calling in who are very concerned about people, you know, their girlfriend or their you know, someone that they know. Where do we go? How can we direct them? What happens? So yeah, so our role is very, very diverse, and I think the more that you spend time talking to families and talking to people in these situations, we actually learn from that as well. And I always love it when people tell me, you know, oh, I've rung this organisation and they were really great. So, you know, the first thing I do is write that down as a resource and think, well, I must remember that in New South Wales, there's this particular service that might be really good for someone. And again, the support services in the different states can be very different. You know, what we have here in Victoria might be very different to what you've got in Tassie or what New South Wales has. So it's sort of, you know, grabbing all those resources and being that listening ear and understanding, and then directing how to get that help.
Sometimes I think it's even about the language that you use. So we can actually give people the words. Nurses are very good at giving people the words to say. You know, rather than talking about it this way, maybe talking about it this way to work out what information that you need. And I think that's especially in MS. We've talked a bit about how, Jane, you gave that really good example of how you can explain how much, you know, I cut my finger and it's bleeding, but sometimes it's really hard to get the right words to describe those invisible symptoms, and therefore help access the services that you need. And that can be services as in medical services, or it can be accessing the support that you need from other people as well too. And the more stories that nurses hear, the more words that they've got to be able to help the next person to say, oh yeah, you know, that's if you explain it to your doctor in this way, this might achieve this one, or if you explain it to your family or friend in this way, that might help you achieve that. And the reverse true, if you can speak to families and friends and say, have you asked this question? Have you asked that question? So it's just having that strong base of knowledge about MS, and like you said, hearing lots of people's stories. And I do happen to know that the nurses little book of resources that's in the head of these three nurses is astonishing in terms of what's available where and when, is absolutely very important. So what we've had is a couple of questions. So I'm going to put the nurses to the test. Yeah, we got a few questions coming in early, so I'm going to ask just a couple of those questions. For those that we don't get time to address, then we will certainly get back to you. We do have your names and details, but let's start. One person asked in to say, does exercising really help? Now, I also know that one of our people is a big well, we're all exercisers really, aren't we? But Michael, what's your take on the value of exercising?
Definitely. Look at, and people hear us say all the time, you know, medical research demonstrates or provides us with the knowledge base that people who exercise do end up doing a lot better in the long term with living with their MS. People often ask the question, oh, well, I'm already so fatigued that how on earth is exercise going to benefit me, because I'm so tired I can't really do it. But it definitely has been shown that, yeah, if you can get involved doing a little bit of exercise each day and then trying to just push yourself a little bit further each time, that all of a sudden you are able to do a little bit more. Those fatigue levels do settle and not quite as extreme, and you just seem to gather that little bit more stamina, whether it's the getting the blood flow going around your body, or just, you know, the lovely flowing hormones start flowing around. I'm trying to think what the right hormone is that makes you feel good. Endorphins, get the endorphins moving, and people, that it genuinely does make you feel better if you can get out. Sometimes it's a good way to take your mind off sitting around and thinking about what's going on as well. If you can distract yourself, exercise is a fantastic way of distracting yourself as well. Sometimes if you're sitting, rather than sitting and dwelling on a problem for a length of time, then get up and do a little bit of exercise if you can. But yeah, that's that lose it, use it or lose it sort of mentality fits in there. So and it doesn't necessarily have to be walking. You can exercise in a chair by sitting in a chair, watching the television, have some little simple hand weights or something just to move your arms around, work out what it is, which part of your body is experiencing the weakness. Hop off to see an exercise physiologist or a physiotherapist to get a program specifically designed for yourself, and then work on that and work on it well, and you will definitely reap the rewards. No doubt about that at all. And as you said, I'm a mad keen exerciser. I walk myself silly. I don't even know what I'm up to, 430 odd kilometers for May already. So my May 50K has gone way over. But as I said, I just love, getting out, fresh air, change of scenery, and as I said, getting those endorphins moving. It really is a positive and very beneficial thing to do.
Yeah. Jane, Bridie, what's your take on does exercise really help?
Yes, I agree with Michael, and specific to MS, I think there's some research that might talk about certain types of high intensity interval training that can be helpful, and also the cognitive aspect as well. I believe there was a study with mice, and one group of mice just ran on the little wheel, I don't know if that has a word, ran on the little wheel, and that's all they had to do before they could get their little treat. And the other group actually had to go through a maze. So they were running, but had to make decisions about which way to go before they got their little treat at the end. And the distances increased, but at every stage, the one on the wheel was doing the same as the other. I think they did a biopsy and determined that actually the running through the maze and actually having to make cognitive decisions whilst exercising actually had better protective properties on the myelin and on the central nervous system. So I thought that was quite interesting. I heard a neurophysiotherapist speak on that, and she spoke about changing up the types of exercises that you do as well. And then I think on the flip side to just focusing on MS is focusing on you as a whole person. So the majority of people with MS are women, but even with men, we need to think about aging well. So you want to have strong bones, you want to have some decent balance, we want to be able to hold the core and the continents together, and think about yourself in your matching velvet tracksuit when you're 85 years old and going to bingo with the blue rinse in your hair. Do you want to be well? Do you want to be on your feet and doing things? And what we can do, what is within our control to promote that, is boring, sustainable health habits in terms of diet and exercise. So I would say, yes, exercise helps MS, but separate to that, it's going to help keep you strong and agile and prevent injuries so that you can age well and assumingly live as independent as possible, which is what most people want to be able to do.
Yeah, I think sorry, Jo. I was just going to
go, Bridie.
Sorry, that's absurd. I think we also need to remind people who are a little bit more disabled with their MS and who are wheelchair bound and don't have the ability to go out and walk and things like that, can still do a form of exercise, which is really good for specific things for contractures and muscle tightness and spasm. I think if you can sort of get someone to work with you to do little things like that, it's still sort of moves the tendons and the joints and gets the oxygen and the blood flowing. So yeah, there's, you guys have covered all the rest, but I think, yeah, just even the smallest amount of exercise can make a big difference.
Yeah.
Well, to the person who asks that question, I think the jury is there's no question there that exercise has been shown in the research again and again and again and again and again to have real long and sustainable benefit in that one. So then another question was, what would be the best medication for nerve pain?
Righty.
Righty.
Okay, so what we know about nerve pain, it's one of the more difficult types of pain to manage, and the nerve receptors really only respond to certain types of drugs, and they're drugs that are prescribed for neuropathic pain. And I guess you know, like I would never sort of, you know, say you need to be on this, and this, but your doctors will know what specifically they will be. There are 4 main drugs that we see used a lot for nerve pain. And they're drugs that are typically used for depression and epilepsy, and they respond really well with the nerve receptors. So it really depends on the extent of your pain, and I guess you know, that discussion that you need to have with your neurologist. And I encourage anyone who has trouble with nerve pain to actually give us a call and have a discussion one-on-one, because I guess it's also dependent on what you've been on, what you've tried. But generally, I tend to find that people do really well on, you know, slow release medications twice a day to keep a therapeutic level in the bloodstream, because in general, we find a lot of people with nerve pain might be just on something at night, and then what you've got is this accumulation of nerve pain as the day goes on, and you get to nighttime and you're trying to sort of put out a bonfire rather than a smouldering fire. So we find that if you can sort of have something like that and then something with breakthrough, and these are the discussions that you can have with your neurologist and potentially your GP. A lot of the opioid medications that some people are prescribed can give you a general euphoric effect and can be really good for acute pain along with this medication for neuropathic pain. But what I find is if you're on that as a long term, I'm finding a lot of people who have this really chronic nerve pain sort of just increase these doses and they're really not getting anywhere. So it really needs to have that really good discussion. But if you've got a neurologist that really understands that you have this pain, and when we're talking about neuropathic pain, we're not just talking about pain as such. You know, this neuropathy sort of thing can also present as extreme numbness, tingling, burning, altered sensations, ants crawling on your skin, water dripping down your leg. I've had all sorts of description of all these things. Yeah, itchiness. You know, and then you've got, you know, it can come and go. You know, a lot of people have it continually. Then you've got your things like trigeminal neuralgia, which is a paroxysmal type pain where you're getting, you know, the shooting pains down the face and into the jaw. You've got the MS hug is another type of a nerve type of pain that people talk about, which is that really tight squeeze that people say around the abdomen, and it can be really uncomfortable. All of these sort of things respond well to these neuropathic based drugs. So please, if you are experiencing that, we know that over, I think the last statistics that I read on was 66%, I don't know, Jodie, you might be able to correct me on that, do have some form of neuropathic pain at one time or another. And it can be exacerbated by fatigue, poor sleep, poor mood, lack of exercise, hot days. You know, it is really something that you should deal with. And I'm happy to chat to anybody about it. And I guess the other thing to sort of talk here is, I guess there's been a lot of discussion around CBD oils, you know, cannabis oils, which we are seeing now used a lot in pain management. Traditionally a lot used in sort of cancer pains, but now we're sort of seeing it in a lot of this chronic pain and neuropathic pain. And often that sort of comes after you've trialled these sort of more traditional, I guess, type medications. But there is certainly a lot that can be done, and and please, and just encourage you to talk up about it and don't just put up with it, and see if we can get, because I guess the ideal is that we want you on something that is going to give you some management of the pain so that you can function and everything's okay and you're managing that pain level, but we don't want you to be wiped out. So there is a bit of a trick to titrating the drugs and getting to that right level of medication, and you do need your health professionals, your medical team, to be overseeing that. Really important. And then as well as that, there is the physiotherapy and some psychotherapy, so some counselling around the pain management as well.
Well, that was a big answer, but also in saying, I guess all of those elements of it just showed that the need for individualisation. And so we're nearly out of time now, but a lot of the other questions were, well, as I said, we will get back to all the people who had questions. Just to chat through it. I know a very common questions that every person has got their own story, and it's often better just to have that one-to-one sort of conversation as well too. And a lot of the questions we got in, I thought, really, even when people ask what's sort of frequently asked is when is it secondary progressive? There's no right MS. That's probably one of the big questions that people ask a lot of, but there's no right day where that happens. And often it's better to talk it through and say, what's going on with the person? Because what's going on with the person, that sort of, one, why are they asking the question? What's worrying you? What's the problem? Let's get down to the bottom of that. And as I said, nurses can really delve deep into those, you know, dig deep into those different areas to say, we can actually talk to you about all the different aspects. So we will get back to you about those questions. So I'm just going to, we've covered so many things today. So I'm just going to ask you your 2 top tips. So I'm going to start with Michael. Can you remember, because we have talked about this one in the past, what's your 2 top tips, Michael?
My 2 top tips. Number 1 would be, if you're experiencing symptoms and there's uncertainty around what's going on, is this new disease activity, is it a flare? Certainly get in touch with somebody that can talk through it with you and get you to understand what's going on. If it's relapse activity, there's an opportunity to jump on it and dampen it down before it gets too bad. So I think it's that understanding that if something's presenting as new symptoms for you, something that you've not had before, and you're uncertain, then at least reach out to your MS nurse or to one of us here at MS Plus and just have a chat about what's going on, so that at least we can make that determination. What do we need to do about it? That would be my number 1. Don't beat yourself up too much about, you know, seeking help. It's important. I think, if, like we've already discussed today, talk it through with somebody else, and often you might get to the end of the conversation, realise that you were worried about nothing, or that you had a genuine worry of what was going on, but at least you have a solution or a pathway forward to deal with whatever it was that was causing you the issue. Number 1. Number 2, when you've been to see a neurologist and they say, oh, we'll see you in 12 months' time, off you go, hopefully everything will be all right. You walk out the door and a week later something happens, something's starting to happen. You might be having a bit of relapse activity, or you're just noticing that your symptoms are worsening for whatever reason. Don't think that you can't reach out to ask to see that doctor again, just because they've said to you, I don't want to see you for 12, well, not in that sense, but they're saying, oh yeah, everything's going along nicely, we'll see you in 12 months, 6 months, whatever it might be. If something happens a week after you've had your review, and quite often it does, and you sort of think, oh, you poor bugger, you've just seen the neurologist and now this has happened, for goodness sake, reach out again to the nurses. Often they've got a nice little linked to the neurologist that they can speak with the neurologist and say, oh, Jodie's just called me and sounds like something's going on. I know she only was here a week ago, but do you think we can get her back in and have her reviewed again sooner? So yeah, don't always go with what the neurologist is saying to you. I know they're busy and they might not always be able to get you in urgently, but sometimes there is an opportunity to do that. So yeah, they want to know what's going on with you. So make sure they know. Feed back to them so that they know what's going on. That's my two.
Great. Bridie.
Yeah, similarly to Michael, reach out if you're concerned. Don't bottle it up. If it's on your mind, ask about it. Otherwise, your anxiety levels are just going to keep growing, and nothing is a silly question. And one of my biggest things is be yourself, not the disease. Really important.
And Jane.
Thank you. I think the big thing is that symptom management, and we call it management often over treatment, actually, if you haven't heard of this before, because most of the time we may not be able to just get rid of it altogether. So we have to manage it. We just have to mold it and shape it. But when we're talking about symptom management, quite often it doesn't happen overnight, but we can get there. So it's very unusual for someone to go to their doctor with nerve pain, changes to the bowel and bladder, spasticity, whatever it is, and say, this is my problem, and then be able to walk away with a solution, try it, it works, done, I'm solved, that's my life sorted. Very rarely does that happen. So set yourself up for a little bit of a journey, but you can get there. We can get symptoms to a place where they're not encroaching on your daily quality of life. So do stick with it. And as to what Michael was speaking about in terms of reaching for help, know when you're walking out of that appointment. I know when this medication's supposed to start working. I know when the side effects should have gone away. I know what to do if it doesn't work in that time and who I can call. So make sure you know so that you're in charge of your symptoms. And then my second point would be, watch your self narrative, because you are with yourself all the time and it matters what you say to yourself, how you think about yourself. I spoke to someone this morning who just reported that they're having an awful time. Work is stressful, there's family stress, they're fatigued, they're not sleeping overnight because of other medical issues, and they feel like they're doing a terrible job. And when they explained it to me, I said, that does sound awful, but it sounds like you're doing an amazing job. Given that everything is happening and you're still succeeding in all of these places, you are doing a phenomenal job. It feels yucky because it is, but you're doing really well. So be very mindful of how you speak to yourself, and whether you say things like, I'm a failure, or I'm lazy, if you're not able to do something because of MS fatigue. That does make a difference. It does matter. You don't have to be toxically positive to yourself, but really think hard about how you're speaking to yourself, because most of the time we would treat other people better. We would often speak to a friend and say, you are doing such a good job, don't worry about it, you're really doing great. But we would never say that to ourselves. So they were my two tips.
Thank you. Yes, we do not encourage ourselves enough. We encourage others a lot, but we need to encourage ourselves just as much in how we do. They're all great tips, and the very loud message was also in terms of that very loud message of reaching out when you need help, and that sometimes it can be hard to get in contact with a nurse. We know that, but we certainly are available, and if anyone needs to. And as I said, we don't work alone. We work a lot with the nurses in clinics as well too. So if you want to give us a call, you can call Plus Connect on 1800 042 138, or email can be such a good way of helping you initiate a conversation that you might feel awkward about. It can help trigger the conversation. It can also help you arrange a time to call. So connect@msplus.org.au. Love email. It helps you. It also helps you define what you want to discuss as well too. So feel free to give us an email as well too. And then yep, that's all. I think thank you, and please stay on for a short survey. Thanks, Michael, Bridie and Jane. Thanks for your time.
Thank you all, and thanks to everyone who listened in and joined us today.